All this is Dr. Mobeen Sayed from Drbeen.com. I know that we have presidential debate today, but I wanted to talk about the brain fog and the other neurological symptoms for long haulers by COVID-19. So my apologies. I would try to get you free as soon as I can, but this was an important topic and I wanted to make sure that we can look into it. So here are a few links that are in the description. One of the link here is follow-up of adults with non-critical COVID-19 2 months after symptoms onset. In here, they are talking about the long hauling symptoms in patients, sometimes even after 2 months. Then here is the important one to look at. This is into the looking glass, post-viral syndrome, post-COVID-19. So post-viral syndrome is what we are calling long hauler. So this is an important one, and I'll be discussing this letter. It's not a study, it's a letter. Then that letter is based on this set of medical concepts which are called glymphatic system of the brain. So we're going to talk about that. And then here are another few additional links that may be useful. For example, how to assess physically the patients who may develop neurological symptoms. Then the glymphatic system itself, how does it look like? And then cerebrospinal fluid, how does that look like? At the end of the discussion, we would also discuss how can a person who has neurological symptoms because of long hauling, how can they help themselves and start becoming better? And I'm going to give you the example of this case in here, in this paper or this letter. They have a case of a 42-year-old male who had developed long hauling symptoms and how they help them. And there is no medicine other than melatonin that would be needed. So I think it would be interesting to watch out for what is the solution. Again, that solution is not going to be for all long hauling symptoms or issues, but for the neurological, you would see that there is a decent outcome. So with this, let's start. Thank you everyone for joining while we have a presidential debate going on as well. Let's discuss this. And again, I'm going to try to be as fast and quick as possible. So brain fog, myalgias are muscle pain, depression, fatigue, and other such symptoms that have occurred to many. And this is not just for COVID-19. This can happen to other. This can happen after other viral infections as well. Normally, these are called chronic fatigue syndrome or myalgic encephalomyelitis. So we'll talk about these things today. Basic concept to grasp here is that reduction in glymphatic system function may be responsible for this outcome. That is a basic thing. What does that mean? The lymphatics of the brain, they are not draining correctly. And because of that, there are cytokines accumulating in the brain and the fluids accumulating in the brain that then cause the long hauling symptoms. So the concepts we're going to discuss today are the following. At the end of the discussion, number one, you would know how the glymphatic system works. Number two, you would know why in COVID-19 it becomes disrupted. And number three, you would know how do we help this situation. And my request to you is that if you know someone who is in a long hauling situation and they are depressed or fatigued or myalgic muscle pains, please share it with them, or they have continuous anosmia, share it with them. So Arun says, question, what is brain fog? Brain fog is a state of confusion that you do not feel fully alert and fully engaged. There is a continuous dark type feeling and confused feeling. So let's look at the basic anatomy, which is important. And again, this is a very complex area, and I'm only going to talk about the higher level of the concept so we can grasp the basic problem. So look, what happens is in our brain, there are 4 kinds of fluids. Number one, blood that is in the blood vessels. So in the brain, of course, there are blood vessels. They contain blood. So 10% of the fluid in the brain is compartmentalized in the blood compartment. Another 10% is in the CSF compartment. Another, I believe about 65 to 70% is in the intracellular fluid or interstitial fluid, and that is between the cells of the amongst the cells of the brain. Imagine the brain tissue neurons are bathed, they are living in fluid. So that is called interstitial fluid. The whole body lives in fluids, and that all is called interstitial fluid. So interstitial fluid is the third compartment, and the fourth compartment is cerebrospinal fluid or CSF, which is living in specialized compartments. So here what we are seeing is the following. Inside the brain, there is a ventricular system. There is a cavity inside the brain. That cavity is filled with fluid. That fluid is called cerebrospinal fluid, and it is produced here by what we call choroid pluxes. Choroid pluxes are specialized structures where blood vessels come in, and then there is blood-brain barrier between the blood vessel and the tissue or the ventricle, the cavity. And then there is a filtration of the blood with some active transport. That means we exert energy to pull some things from the blood and bring them into the CSF, but we do not let everything come in. I have discussed the blood-brain barrier once before as well. So these are those places. This is a third ventricle. This is the roof of the third ventricle. Then here is the fourth ventricle. So there are the this is the roof. This is the floor. So in the ventricles, there is cerebrospinal fluid making processes, which or structures that are called choroid pluxes. These choroid pluxes fill these ventricles. The blue things here are the ventricles. So this is the lateral ventricle. Then we have third ventricle, and then we have aqueduct or a small cavity in the brain. And then we have the fourth ventricle. This is the fourth ventricle. And then fourth ventricle then continues downward as a small tube that is in the center of the spinal cord as well. Central canal, we call it. The fourth ventricle in turn has three holes in it. Fourth ventricle looks like a tent. If you look at it from behind, it would look like a tent-like structure. So in this tent, there is a central hole, and then there are holes on the side. I remember I used to love them, the names foramen of Lushka and foramen of Magendie. So these are those foramens or holes. Through these holes, the CSF that is produced here, that CSF would come out, and then it would go into subarachnoid space. So what happens is that whole brain tissue is wrapped in meninges, which are tough connective tissue around the brain, and then there are spaces between them. So subarachnoid space is one such space. So the fluid then come out and they go into the subarachnoid space. From there, that fluid kind of travels through those spaces, and eventually it goes back into venous or sinuses, we call them, which then becomes veins, and that is how the fluid gets out. However, here is the important part to understand. This fluid that is in the subarachnoid space, this fluid not only just gets out through the veins, but the blood vessels, the arteries of the brain, when they run in the subarachnoid space as well. And I would show you that over here. So this is a subarachnoid space, and this is an artery running in it. So when these arteries are running in the subarachnoid space, and then they penetrate in the brain tissue, around the arteries, there is a continuity of a space which is closed space, and we call that as periarterial space, or the space around the artery. So imagine if the artery is a tube, then we have one more tube on top of it. So the space between the two tubes is called periarterial space. The CSF, or the cerebrospinal fluid, actually enters this space as well. So not only it goes back and gets drained in the veins, but it enters here. And when it enters here, this becomes that glymphatic system. When the CSF enters here, then that CSF would slowly start oozing out of these cells. And I would explain how that happens in the next diagram. Once the fluid oozes out, it kind of gives a bath. It bathes the cells here, the neurons, And what is the benefit of bathing them? The inflammatory particles, the big proteins, those harmful or debris or the harmful substances that are in the brain, they cannot be approached by our remaining immune system. So brain has its own immune and lymphatic system. So that system is now being developed in front of you over here. So the fluid comes out and starts bathing the neurons, and whatever debris is being produced during the metabolism of the various functions, plus if there is an infection or there are inflammatory proteins, they are all here. And what happens is that this fluid washes those things, the debris, away from the brain and out into the venous system and the cervical lymphatics and back into the circulation. So that is how the bigger particles in the brain that are debris are removed. And this is called glymphatic system. The problem in the long haulers is that this glymphatic system does not work correctly. And why does it not work correctly? I'm going to explain that part now. The glymphatic system, or this fluid that comes out, the CSF that comes out and bathes the tissue, that CSF then drains out in the veins. Majority of the drainage, so check this point out, majority of the drainage is through the veins that are near the olfactory system. And you know that COVID-19 causes the inflammation of the olfactory nerve, this nerve that is responsible for smell. So when that nerve over here, there is a cribriform plate that is called a bone through which it kind of penetrates and comes out, the nerve. And we have talked about the anosmia in the past and looked at the mechanism that there is swelling in there and there is infection in there. Now what happens is when somebody's olfactory nerve is infected, that causes a blockade in that area because the nerve is swollen now, or not the nerve, the tissue around the nerve is swollen. That blocks the glymphatic system, this system that is draining from that area into the sinuses and into the mucosa of the nose. That is the majority of the drainage for the glymphatic system. So if you swell this area, then the drainage of the glymphatic fluid is blocked or reduced. When that drainage is reduced, imagine what? All of that fluid is now accumulating in the brain, plus it is not washing away the waste products and the cytokine products or the inflammatory products in case of COVID-19 that have entered the brain through the olfactory nerve. They are now just sitting in there. They are not being washed out. And when they are not going to be washed out, their effect is brain fog. And how do they do it? Their effect is anosmia. Their effect is brain fog. Their effect is myalgias, fatigue, depression. And how does that happen? There is a part in the brain called hypothalamus. This area, this brown thing here, is hypothalamus. When the anosmia occurs, or when the swelling in the nasal olfactory, near the olfactory nerve occurs, then hypothalamus gets affected as well, and most of the debris that is near hypothalamus stays there. And when the hypothalamus is affected, hypothalamus's job is to reduce the fever or keep the temperature correct, and then its job is with the sensations, and its job is with the many of the emotional systems. So what happens is once the hypothalamus has started malfunctioning, the patient might develop fever, and they might develop fever for a long time, months. They might develop depression. They might develop tiredness and fatigue and myalgias. So that is because debris is not being cleared because the olfactory system is blocked. So that is a very, very important thing. Now, what is at an atomic level, at a smaller level, at a unit level, how does this happen? So look, this is the subarachnoid space. This is this space here, this space. I'm just zooming in that part. In the subarachnoid space, the blood vessels or arteries that supply the brain, they bring blood and they are here. And then from here, they would enter the brain tissue. And if you see here, these green cells around the blood vessels are called astrocytes. Astrocyte has foot processes, or they have dilated feet, and they make a covering around the artery. So they make a tube, they all come together, and they make a tube around the artery. That tube in this diagram is this green set of cells here, or the tissue. That is the tube. Inside the tube is this artery, and between this tube and the artery, the space here is called periarterial space. In this space, CSF is present. Then what happens is that CSF oozes out of this tube through specialized channels that are called aquaporins, or these are water channels. And through them, the CSF comes out, and when it comes out, it becomes interstitial fluid. It becomes ISF. Now, in this area is the brain tissue. I just made one cell of neuron here just to represent the brain tissue, but imagine that all of this area is filled with brain tissue, neurons. So the fluids that are coming out are now bathing the neurons and bathing the tissue and trying to clear out any debris present there, any inflammatory cytokines present there, any antibodies present there, or any damaged bacteria, pathogen, whatever debris that is there, they are going to be. This fluid is going to take it away and go towards the vein. Veins are normally the things that drain the system, correct? But here is the important thing. The fluid would not enter the vein. So here is the vein. What happens is around the vein, there is another tube as well made by astrocytes. So the space between the vein and the astrocytes, so this is another tube within a tube. This space between the two tubes here around the vein is perivenous space. And this fluid is going to enter the perivenous space. From there, this fluid is going to get out of the brain through cervical lymphatic system and through the olfactory lymphatic systems. So this is at a small, if we zoom in, this is what we see. So now imagine that for some reason, this outgoing path is not working. It is blocked. What is happening is fluid is coming in. There is debris present here. Maybe cytokines are present here from the COVID-19 because they came in through the olfactory pathways, but they're not going anywhere. And now they are just sitting there and causing hypothalamic malfunction, which would mean depression, fatigue, and anosmia, and many, many other things. So now the question is, how do we fix this? Fixing this is actually a simple process, fortunately. And I'm going to give you the example of this patient here. So this is a 42-year-old male, excuse me, who developed this fatigue syndrome after COVID-19. And how did they manage him? Look, it's very, very simple. Number one, they asked him to do central lymphatic drainage. That is this cervical area. You drain it. Normally, they would ask you to drain it like this. And you can see, you can do Google, and you would see many of the videos that allow you to see how to do the central lymphatic drainage. So one thing they asked him to do was to do central lymphatic drainage. First, they treated him in the clinic with massage to show him how to do, and then they asked him to do it by himself. So central drainage is one. That would take the lymphatics of the brain out and reduce the pressure plus the debris in the brain. Secondly, they asked him to move his spinal cord or have spinal cord dynamics. And the result of that is that when he moves his spinal column, that causes pumping effect of around the spinal cord, and that also pushes the CSF and pumps the CSF, and that causes the CSF to get out of the brain system as well, or circulate better. So these were the two things. And the third thing, you would love this one. They asked him to sleep better. And why is that? So let me explain this last part, and then we are done with the discussion. What happens is that they found that when somebody sleeps well, do you know that this is such a beautiful thing? This glymphatic system only operates when we are sleeping. During our waking hours, it stops operating. So that means the longer you are awake, the longer the debris and all the cytokines and inflammatory things are just accumulating, waiting to be drained when you will go to sleep. The question is why during the sleep and why not now? for example, in all of us. The reason is very simple. When we are awake and we are alert, we have norepinephrine, which is a hormone or neurotransmitter as well. It is released. Norepinephrine, epinephrine are related to fight and fright kind of behaviors. They keep us alert and they keep us toned up and they keep us moving. So when our brain cells have norepinephrine available because we are awake, the brain cells swell up a little bit. They function more, they metabolize things more, and they kind of become bigger at a microscopic level. When they become bigger, imagine that the brain tissue has swollen up a little bit, not for the harmful effect of it, not enough that it would cause harm, but enough that it would compress. It would compress these blood vessels and these astrocytes here. So imagine if there were too many neurons here and they swell up. They swell up is swell a word. They swell up and they pressed on the astrocyte and they press this thing inwards. That reduces the space and that blocks the fluid movement. That is one. Secondly, norepinephrine, when it is present in the system, it causes less activity of the blood vessels. And when the blood vessels in the brain, the blood vessels, arteries especially, have a pumping effect. And that pulsating effect would also move the CSF. So in the presence of epinephrine, norepinephrine, that pumping effect is reduced as well. So on one end, we are not pumping the blood vessels enough to cause the CSF to flow. And number two, we have caused the brain tissue to swell up a little bit and compress the areas through which the flow would occur. So during the waking hour, the glymphatic system is not working. So if I have an infection, and right now there are some cytokines getting collected, let's say in case of COVID-19, my olfactory nerve is infected, and from there the cytokines are going into the brain. They're not coming out because I'm awake. So when I will go to sleep, norepinephrine levels would go down. The brain tissue would shrink a little bit. And I'm using the word shrink liberally here. This is a microscopic reduction in the size of the neuron because the neurons are not metabolizing that fast anymore because we're sleeping. And that opens up these spaces. And that causes the pulsation to occur as well. And number three, the CSF production increases because the arterial pulsation increases, the choroid fluxes work more, and CSF production is increased. So you can say that janitors come in when we are sleeping and they mop up the whole brain tissue and take the debris out and take the cytokines out and they clean it up and they make it shiny and pristine again. And that is what makes us less depressed. That is what makes us less depressed and tired and dizzy and brain fog or confused or myalgic. So simple solution for those long haulers who have neurological symptoms. Of course, they have to go to neurologists and look at what is going on. But at the same time, central massage, that is one. Spinal cord pumping, that is two. And sleeping better. Sleeping better is for all of us. It is not necessary that we have COVID-19 to sleep better. We should sleep better every day anyways, because when we are not sleeping, our brain's debris is not getting removed. And if we are not sleeping enough, it would not have enough time to remove the debris. It would stay there. And I saw a paper today which connected this phenomena of less sleep to Alzheimer's and to other dementia states, because they are saying that because we're sleeping less, that means that the lymphatic system is working less, and that means that we are keeping the debris, including beta amyloids that are responsible for Alzheimer, in the brain. They're not washing away, they're not being mopped away, and that causes the brain damage, which causes memory loss, which causes dementia, which causes Alzheimer's. And final comment, and then we stop. The papers found out that it does not matter how you sleep. Do you sleep naturally or do you take something and sleep? As long as brain is sleeping, as long as it is at rest, it allows the glymphatic system to work and brain to be cleared out of the debris. So that means if you cannot naturally sleep well, then take melatonin. Melatonin is good for COVID-19's prophylaxis anyways. So take melatonin and sleep well. If you can sleep well without a sleep help, then sleep well. So that is the discussion for today. Please make sure that you like, subscribe, and share with those who may have long hauling symptoms, especially neurological symptoms. I think this is a very useful thing for them to look at. And the solution is very simple as well. Melatonin is over the counter. The manual massage is manual massage. There is nothing special needed. Movement of the spinal cord is also a manual massage, manual process, and it is in the control of the person. And finally, if you would like to support my work, there is a donation link in the description. And this is what we have for today. I would let you go back to the presidential debates. I have already voted, so my vote is here, and I would see you tomorrow. Thank you very much.